So the Time Centre started off as a small digital mental health network in 2019 and has since grown to become the centre that it is today. When we first started out, the goal was trying to bring together a group of like-minded academics, service providers and industry professionals to really tackle some of the big challenges today in mental health and education.
Working in partnership with the Time Centre is really beneficial. We're not just passive recipients of technology, we're actually helping to develop our own.
A lot of the research that happens within academic institutions can be very much lab-based, and there's a really important gap we need to address in terms of implementing these interventions within real-world clinical practice.
It allows clinicians to be involved in the planning stage. It allows service users to contribute, to give feedback as we develop and iterate on the technology, so that by the time we have developed something, it has been processed with a lot of engagement to that stage, better suited for clinicians to utilise that, to actually implement it, and better suited to meet the needs of our client population.
Through these industry partners, we get access to not only some of the latest equipment, but also the latest ideas and thinking within the field. People who are really at the forefront of pushing technology and working with technology as it becomes immediately available. This has really helped accelerate the work we're going to do and the work that we're currently is ongoing within the Time Centre.
So for us, for an IT company, I think it's invaluable to have a university behind us and collaborating very closely with the university, where the evidence that we are gathering has published paper, has verification and certification really, and it's the fact that they can actually then produce and publish these benefits on a proper paper, and that can then obviously be used then to go ahead and to push then into the market to see that we've actually got clinical and university backing in the technology that we're developing.
Well, from an educational perspective, I think the Time Centre helps bring so many different disciplines together and lets everybody put different ideas on the table that it's only going to benefit the populations that with whom we're working with.
We are an interdisciplinary school, but still what you see is that a lot of research happens in silos. And I think what's really great here is that we are seeing people from social work, from education, from health coming together to develop those innovative projects.
One of our biggest challenges at the minute, and which is strategically aligned to the HSC Digital Strategy 2022 to 2030, is that we build a digitally capable workforce. Looking to the future, digital health and the use of data is going to be paramount in how we deliver health and social care in Northern Ireland, and therefore we need to look at how we prepare our workforce for the future.
The Time Centre really offers a really good platform for the next generation of healthcare professionals and the students coming into research. I also think there's a lot to be said about that kind of level of mentorship and support that we get here, and it really does help with your own confidence.
Paul has very kindly invited me over for a few kind of sessions with his students, and I've been very impressed looking at some of the work that the students and the different research students have done, the kind of work which is really within mental health and education. Particularly impressed about how he's able to use different types of technology, in particular virtual reality, to try and address some of the more challenging problems that we have, be it in mental health or education.
Through the Time Centre and through all of our developments, it's that building that community together with all the different professionals, all the different academics coming from different sort of disciplines, all coming together and saying, look, if we were bringing this from education, this from mental health, and bringing this from virtual reality, it's a win-win for everybody.
Digital is everybody's business. When we're looking after someone in hospital, in the community, in their own home, in primary care, it's a multidisciplinary approach to that person's care. Therefore, in education, we potentially could get better at doing multi-professional learning, and digital health and care definitely is an arena where we could get better at teaching and training and skills development multi-professionally.
So the vision of the Time Centre aligns well with the Queen's University Belfast 2030 strategy. We're looking to really build a community and research culture in which to maximise innovation and the impact of the research we're able to do.